Yeah, hello. My name is Jane and I'm the Chief Nursing Officer for England, and so as you heard, I am the Chief Nurse for the country, and that is quite scary anyway. And what I wanted to do today, and actually I am incredibly daunted at talking to this audience. And I know that sounds daft because some of you in the audience are professional nurses and will have probably heard my name, and some of you may have seen me, and you'll know that I spend a lot of my time talking. Not literally, well, I do actually spend a lot of my time talking anywhere, but I do a lot of professional engagements. I was at a big conference yesterday. I can speak to hundreds and hundreds of people in one go, and actually I'm probably more nervous now than I normally am, and the reason for that is there are lots of experts in the room. There are lots of people with type 1. There are lots of people that know a lot about it. And we've heard some amazing stories and some very humbling stories. And I also feel very bad about the fact I don't do a great deal of exercise. And although I have got one story to tell about that a bit later. So what I'm going to do is tell you a very personal story about my experiences. And so it was really interesting when, how many of you know, there was a significant amount of no in the audience. And I think that for me is that's quite a bit of reflection for me about why I haven't spent a lot of time talking about the fact I've had diabetes since I was 19. And maybe as we go through my presentation and my talk, I might some of that may become maybe a little bit more apparent, or we can have a think about the reasons why. So that's me. That was a photo shoot that Woman and Home magazine did for me. And I was classed. They asked me if I would go into Woman and Home, and the main reason was they'd read a blog that I'd written about being diabetic, or having diabetes, because I don't like calling myself as a diabetic. And they asked if I would go on. I would actually. They did a whole thing about 4 inspirational women, which was a bit scary. And they did an interview with me. But they also did a professional photo shoot, which I'd never done before. And it is actually amazing. If everybody gets a chance to do it, then it is amazing, because they did my hair, my makeup, and they gave me dresses to wear that I would never, ever have put on normally. And I was doing the really pathetic thing that says, I don't wear red. And they went, no, you've got to. And I went to this beautiful house in Brixton, and I had hundreds of photos taken of me, and then they sent me a couple. So I thought, when I did the slides, I decided to use one of those. Anyway, that's just a by the by. So, this is Southmead Hospital in Bristol. The bit on the left that you can see is what was then the old nurses' home, and I actually did have a room there. And I was diagnosed when I was 19 years old. It was 1980, and I was a first-year student nurse. And it was a job that I'd wanted to do for quite a long time. I was thoroughly enjoying it. I was working incredibly hard. I did art type A levels. I didn't do science ones, and I didn't do biology for O level. So I'm talking, for those of you that are young enough in the room, that O levels were before GCSEs. And I literally had to work my socks off to be able to keep up with some of those people that in those days had done pre-nursing courses or had done all the right types of O and A levels. So I was working really hard. I was also working on an acute medical ward. And one of the patients that I was looking after was a diabetic, and she had bilateral amputations and was blind. And I can still remember her, and I can remember where on the medical ward she was, where her bed was. And I can remember thinking, oh my God, when I was diagnosed, is that what's going to happen to me? Is that going to affect my ability to become a nurse? Is it going to affect how I can do my job? And in those days, for those of you that are nurses in the room, and medics actually, when I trained as a nurse many years ago, we weren't in university then. We were in hospitals. So we were based in a hospital, School of Nursing in a hospital. We worked full time. We were paid a small amount of money. We did our studying and working on wards and in the community. And we were also counted in the numbers of people that were on the ward. So we would work, when I was in that acute medical ward as a first year, we had 30 patients, and I was one of 4 people. And that included a nursing auxiliary or healthcare assistant and a couple of trained nurses and me. So it was very, very different from the way nurses and other healthcare professionals are educated now, but actually gave me a huge amount of experience very quickly. I'm not saying it was right, but it was. So this is, most of you, I'm not going to, you all know this, but I had the classic symptoms. So I was thirsty, I was drinking lots, I kept nipping to the loo, to such an extent that some of the ward staff were going, what on earth's going on? I had lost some weight. I didn't lose loads, but I was quite thin anyway. But I went down to about 7 stone. You wouldn't believe it now looking at me, but I was in those days very slim. And I had all the classic signs, but I just put it down to the fact I was working really hard. I'd done my first lot of night duty. I was working on an acute medical ward, which was very busy, very heavy. We were doing lots. It was absolutely exhausting work. And I think looking back, I had quite a gradual onset, so I didn't end up being okay, really unwell. I think it was quite slow onset, and I think there was a bit of confusion at the first. And when I was first treated, the first thing they did was change my diet, then give me tablets. So I think they thought I was a sort of early type 2 until I flipped into type 1 very quickly after that. So anyway, I thought eventually I tested myself at the hospital because I thought I'd been taught about diabetes and I learnt about it, and I thought this is just too much of a coincidence. So I tested myself and thought, oh, yep. Went to see my GP, who said, no, you're just tired. I went, okay, look, I've done this. No, you're a student nurse. You've probably got it wrong. Okay. And then I think, and I know this is being filmed, so but I'm hoping that my family or my mum won't see it. But at the time, my mum she had quite a lot. She had a very significant focus on health, shall we say? So it was a bit like Roddy's conversation about the guy that was on their ice trip. She had everything wrong with her, and therefore was in the GP surgery pretty much every week. And I genuinely think the GP thought I developed the same symptoms. I was the same, and that I was imagining it, or putting it on, or whatever. And so he did a blood test, and then he came, and I remember him walking onto the ward where I was working. And I thought, what's he doing here? Has he got any of his patients here? And he walked onto the ward where I was working, and he said, you're right, you've got it. And I just thought, I did at the time, because, sorry, excuse my language. They did the classic. In those days, we weren't put on insulin in an outpatient setting, so I was admitted. For those of you that have been in the health service for a while, we used to do a 10-day pattern, and so I had a long weekend off. So I had a Friday, Saturday as my days off for 1 week, and a Sunday, Monday as my days off for the following week. So I finished a week of work, finished on the Thursday night. I went into hospital on the Friday, on my day off. I had Friday, Saturday, Sunday in hospital. I went home on the Monday, went back to work on the Tuesday. And so I didn't take any time off sick. And what was really interesting was and a big shock was the very, very first insulin injection I was given by one of the nurses. I went hypo. And I am still quite sensitive to insulin. And it was really weird because I kept thinking, I don't feel right. What's going on? I don't feel right. And I thought all my learning, I was still a first year student nurse, but it all came, I must be going hypo. And I remember going up to the staff nurse saying, I'm really sorry, but I think I'm going hypo. And she said, no, don't be so silly. You can't possibly. I said, no, please. Can you? Anyway, so I was. So that was my very, very first injection gave me a hypo. And then I got discharged home. And how many of you use glass syringes? There's a few. I was completely traumatised about using glass syringes. I was a nurse, student nurse. I was in hospital. We didn't use them. I just could not believe it. And I remember being in my parents' kitchen, boiling the syringes for the first time and just crying, saying, I can't do this. This is just awful. I can't do it. But I did, but not for long. Because very soon after that, we were able to use the disposable ones. So this is a picture of me as a staff nurse. This was my very, very first shift. You can tell the age. It's 1982 this was. My Farrah Fawcett, those of you old enough, my Farrah Fawcett major hair. and a waist that at that point was probably about 22 inches. It's now the size of my thigh, I think. But anyway, and my parents' front bedroom, the front bedroom in my parents' house, my mum's still got the same wardrobes. But I was about to go off for my first shift, and the reason I put that up was because I just thought it was worth saying that I actually, my very first job, and actually where my clinical career went, was into emergency care. So I was a staff, my very first job was a staff nurse in the A&E department. And for those of you that work in the health service, and those of you that don't and have used and seen casualty on the telly and have seen all the stuff that you've seen on the news over the years, will know that working in an ED is very much, you're there, you have to respond, it's completely in the moment, and it's very difficult to plan. And it's very difficult to plan your meals and plan your meal breaks and plan what you do. But before I go, I want to talk a little bit about some of the things I did. I just want to give you some reflections on what was really important to me and what had a real impact on me. So immediately after being discharged with my glass syringes and, carb counting and being told how to do that and learning how to not take sugar in my tea and coffee, I shifted hospitals. I went to a different hospital, to a different ward. And the ward sister was amazing, absolutely amazing. She had a daughter with type 1. And it was the best thing that could have happened to me, because she was like, no nonsense, you live with this, it's not a problem, you do this, just get on with it. Get on with your life. Don't let it define you. And actually, I don't think it ever has. And that, for me, reflecting on the fact that not many people know I have type 1, and Partha, when I met him first, didn't know, many people don't know, it was because I've never let it define me, so therefore I probably haven't spoken about it much. I didn't want to be known as Jane Cummings, the whatever job I was doing, the diabetic nurse. I wanted to be Jane Cummings, the nurse, the clinical nurse specialist, the director of nursing, the person that is Jane. I'm not even defined by my job title. I'm Jane. I have a life, I have a family, I've got children, but I've got a family, I've got, that was what was important to me. And I think part of that links back to my mum, because my mum was always defined by whatever health thing she thought she had at the time. And whenever you talk to her, that's all she ever spoke about. I was absolutely determined that I wasn't going to become like that. And there's some positives in that, because actually it has allowed me to do things. And listening to some of other people talk today, it's very clear that mentality, that approach to being the person you want to be and not letting having diabetes define you or stop you, I think is something that quite a lot of us have got. And so I carried on my student training. I didn't let it define me. And I genuinely can't remember any particular special treatment I had as a student nurse until I went to theatres. And when I went to theatres, they were completely traumatised about how I could scrub for an operation, even though I was a student, so I would never be the only scrub nurse, but have diabetes. But the only benefits from that was that I was allowed access to the sisters and the consultant's tea room. Because in those, it's incredibly hierarchical. I mean, I'm talking about the early 80s, so there was a special room for the consultants to go and a special room for the theatre sisters to go, and then everybody else was allowed could go somewhere else. But the consultants' tea room and the sisters' tea room had biscuits. And they had biscuits and fruit, if you were lucky. And I was given permission at any time that I felt like it, I could go and have a cup of tea and a biscuit. So it was like, okay. So to be fair, I didn't abuse it, but I did do it a couple of times. And the other thing they said to me was, you don't have to go into the theatres where we're amputating people's legs who've got diabetes. I said, thank you very much, that's really kind of you. I won't do that. But obviously, clearly that doesn't happen all the time at all. So we're not saying. So that was one of the things that I do remember. And then the other thing I remember doing that was this shift from into different testing and different systems. So that's me. So I went into A&E, and that was my clinical. That was where my clinical specialty was. And I went through all the things that many of you have talked about. The first time you injected in public, what did that feel like? I remember being on a motorway service station and injecting in public, and somebody actually coming over to me and telling me off because they thought I was shooting up heroin, until I pointed out that wouldn't be the place to do it. And even now, sometimes you get weird looks, as you will know, and I still do inject. I don't have a pump, which is more about later. So things moved on, and the reason I've put this up, and there are some deliberate mistakes in this, I thought I might ask and see how many of you noticed them. But the reason I put this up is I wanted to talk about teamwork. So if you think about lessons, and what are the lessons I've learned over the last 36 years, it's about teamwork. And of course, I've got up there consultant, general practice, clinical nurse specialist. Steve Jobs said, great things in business are never done by one person, they're done by a team of people. And I think you can pull that into those of us that live with diabetes. This is not about an individual, it's about a whole team, and it's a team of people. And the thing for me that's really important, both in my own personal life, but in my professional life, is that patients, the people, and their families are an important part of that team. So what's missing off here, apart from our AHP colleagues, dietitians, podiatrists, etc., is the thing that's missing off there is me. And I think, and I did it, and then I thought, no, I'm going to leave it off. And I was going to say, can anybody notice what's missing? But I'm conscious of time. So, but I think for me in there, I had one of the lessons for me was actually talking to people, listening to them, learning from them, trying things out, and being part of that team. And as I go through what happened subsequently, there was something I did which actually was probably, in retrospect, was probably a bit stupid. But when I was nursing first off, and when I was newly qualified, and when I was working initially, I had some great team care from both my GP, but also from the consultant, and particularly the clinical nurse specialist. And you would not expect me to stand here as the chief nurse for England and not say very openly that the role of clinical nurse specialists in helping people live with diabetes should never, ever be underestimated. The impact that they have working as part of those teams and working with people is brilliant. And actually, you often have such an impact. So the people that had the biggest impact on me early on were the nurses, and bizarrely, a consultant obstetrician who used to do pre-pregnancy support for women that want to have children. And I spent 2 years, and this is something I haven't talked about publicly at all. I spent 2 years thinking about, well, trying to have a baby. Never had one, never got pregnant, that I know of. But what I did have was fantastic diabetic control, absolutely fantastic. And I had more support from him in terms of regular blood testing, managing my insulin doses, managing my carb intake. I had 2 years, no alcohol, didn't drink for 2 years. I had absolutely brilliant control for 2 years. No baby, sadly, but certainly no, and I just, for me, that was really important because it was about teamwork and it was about working with people to get the right outcomes, most of which I did myself, clearly, because I had to, but really, really important. And clearly, and as we moved on, we ended up with, I obviously started blood sugar testing. And do you remember those, did you ever have those strips of like absorbent paper? And you'd sort of test your blood sugar and then put them on the strips, and they'd go off to some lab, and then they'd come back and say, this is what the results were. That's what we did to start off with, and then obviously got onto the much newer machines, much better. The other key lesson for me, when I think back about it, is about change. And it's about, as a diabetic or somebody with diabetes, learning to cope with change. And that's about change in your own body and how your body reacts. And it's also change in terms of treatment and new ways of doing things. And there's been so many of you that I've heard today talk about pumps. So many of you that have been walking around with pumps that have got continuous monitoring. And I still have multi-injections a day. I have twice daily long-acting. I have fast-acting before each meal. I still test my blood sugar many times a day, sometimes really frequently. And at the moment, I haven't gone onto a pump for a variety of different reasons, but partly because the team say they don't think I need it. My HbA1cs are pretty good. But that doesn't mean to say I won't move on to that in the future. So coping with change is really important. And I remember coming off when we used to have pork insulin onto human insulin. That was a big change as well. Anyway, I'm not going to spend long on this because this is just a bit boring really. But quite often people say to me, so, well, what did you do? You know, what was your career like? And I just wanted to just really, really quickly say that because I often get asked about my career, I've never let the fact I live with diabetes really affect it. So I was a sister in the emergency department. I became a nurse specialist in emergency care. I did lots of business management, general management, but carried on working as a nurse. I then became a program director for a hospital rebuild, completely rebuilt the hospital. I managed the building company, which was great because I remember interviewing them with our chairman, and the chairman said, and as they came in, the building company all handed me their coats and asked if they could have a cup of tea. So I took the coats, and I'm not being sexist, but they were all men. I took the coats, I hung them up, I made them all a cup of tea, and then I sat down next to the chairman and then got introduced as their boss if they got the job. It was very good. I did smile. Anyway, and then I became a director of nursing, and I was a director of nursing back in 1999, so I've been working at a director type level for quite a long time. And throughout all of that, you sort of learn to cope with the different pressures, the different demands, and you learn that you just need to be aware, self-aware, think about what you're doing, testing, checking, making sure the people around you know, but not actually letting it really, not letting it define you to such an extent that you say, I can't. I did mention, I would say something I did that was a bit unusual for me. I did climb to the very top of the tower crane when we were building the hospital, which was actually really high up. So I climbed to the top of the tower crane and across the tower crane, dressed as with a tutu on, dressed as a fairy. With bits of chocolate, not jelly beans, shoved in my pockets. Because I know you shouldn't have chocolate, but I did at those days. In those days, I did, shoved in my pockets. And but the best bit was I was following a guy who was. Oh no, there was a guy behind me that was coming up behind me to make sure I was harnessed, who was absolutely drop dead gorgeous. So I spent all the time going up and then looking down, and then going up a bit more and then looking down. But I did get to the top, and I raised quite a lot of money. So moving on very quickly, and Partha, please shout at me or wave at me if I'm talking for too long. So I then had a really big change in career. I stopped becoming a director of nursing, and in the early 2000s I took on a national role. So this is a picture of Richmond House in Whitehall on the left and the Houses of Parliament on the right. I didn't become an MP, before anybody wonders, but I did go and work nationally for the Department of Health, and I was in charge of running the 98% target that we had for A&E all those years ago. So there was me and a couple of other colleagues, including Professor George Alberti, who was an endocrinologist, and another guy called Matthew Cook, who was an emergency care consultant. And we basically ran the country's programme to deliver 98% of the people in 4 hours in A&E. And that was a real difference, because for the first time I was working away from home. I was in London during the week. I was travelling all over the country. I was working incredibly long hours. I was doing ministerial briefings late into the evening. They were completely different pressures. I absolutely loved it. And I spent my life running around the country, literally going into different emergency departments, providing advice and support to people around how to improve waiting times. I'm not going to talk about the current position, but it is really, so that was a really busy job, but a massive life change. And throughout all of that, again, I didn't talk about the diabetes much. People knew, I didn't hide it, but I just made sure that I was okay, that I could do this job, that I didn't let it define me, and I carried on doing what I was doing. One of the lessons, though, was that at this point, I was doing most of the care myself, and with my GP. So I was no longer going to see the nurse specialist in the hospital or a consultant or a dietitian. I was managing it myself. I was managing my blood sugars. I was managing my results. And actually my HbA1cs were pretty good. But it was partly because I was so busy and I was running all over the country, but also because I probably got a bit complacent and thought I could do it. And so I'll come back to that in a minute. And then in 2005, I had another major life change. This is my husband, Chris, and in 2005 he was diagnosed with acute lymphoblastic leukemia, and he ended up having lots of treatment, bone marrow transplant, and then in July 2006 he died, and I looked after him at home for the last 2 months, and that was another massive change. I was actually he was my boyfriend, when I was diagnosed with diabetes, and we subsequently got married. And Chris could recognise a hypo before I knew, before any blood sugar test would show. He'd just look at me and go, "You're hypo." And of course, how many of you get stroppy when you're hypo? Yeah. And so he would do, "You're hypo," and I go, "No, I'm not." And he'd say, "Yes, you are," and "No, I'm not." And about, a reasonable amount of time I was right, because it was too early for it to have really dropped. But he'd get really stroppy with me, and of course I'd get really stroppy back, so we had some great times, actually. But it's like, an event, but it was really good. And now I've got a couple of my friends, and actually my brother's really good at recognising it. But the big life change for me was the stress of coping with his illness. Again, him being treated in London, and then taking him home and looking after him, and just not wanting to eat. I just couldn't but I had to, but I just didn't want to. So actually being able to look after him, look after this massive life change, but also cope with the grief, I did have quite a big impact. And then I was also, quite selfishly, I was then I was on my own again. And one of the things that was really powerful was, although I spent a lot of time working away from home, actually he was always around, he was there, he recognised it was like having a safety net. So again, I'd got quite used to having that safety net, particularly at night. If I ended up, occasionally I might have gone to bed with a blood sugar that was on the edge of, should I have anything, or should I just let it go? Most of the time, letting it go was fine, but I always felt quite safe because he was next to me. So that was quite a big shock, actually. And being on my own again meant I had to completely rethink what I did, how I did it. And for a while, I spent a bit of time just leaving my blood sugars a bit higher. Anyway, so I've coped, and it's a long time ago, so it's 11 years ago this year, and I am now genuinely, I think, I'm okay. No, never forget. You can never forget what happened. But one of the other benefits, that's a horrible thing to say, wasn't a benefit at all. The impact of that was I went back, and I went back into nursing, and I eventually took on the chief nurse role in the northwest of England. This slide feels a bit self-indulgent, so I sort of felt a bit uncomfortable actually after I put it together, but it was too late to take it apart. But this slide was more about, I suppose it was more about talking about what's happened more recently, but also about saying you can do things and being proud of achievements. Now, I'm nothing like the athletic brilliance that we've heard Mel and Roddy talk about. I couldn't do that. I've never been good at any type of sport. But there are everybody does things differently, and I guess people achieve in different ways. So I became the CNO, the Chief Nursing Officer for England in 2012. So I've been doing it for 5 years. And it is the best job in the world, and probably for me, but one of the hardest as well. Trying to provide professional leadership to over 500,000 nurses and midwives in England, trying to manage the politics of working with the Department of Health, with NHS England, with others, trying to support the profession, but not being able to do everything that all the profession want, is just unrelenting and really hard. So the hours are ridiculously long. It's incredibly pressurised, but it's also the best job in the world. And you spend time with people, with patients, with frontline staff. You see wonderful things going on in the NHS all the time. And I get so frustrated at media coverage about the fact it's all terrible, because it's not. It absolutely isn't. So it's the best of jobs, but it's also one of the hardest. And that's had quite a big impact on me and my diabetes, in the sense that the hours are ridiculous. So getting home at 9:30, 10 o'clock at night, not eating some evenings at all, or eating very late, then having to stay up late before I can go to bed. Making sure, having meetings without a break, having a non-stop day when I don't stop all day, don't get a break, even testing is difficult. So what happened to me was that I had a couple of hypos that I didn't recognise. And that was really frightening, because I've never had that. I've always been really good. So I started to I had 2 or 3 that came on, and I didn't notice them. And I was at a Macmillan board meeting where I'm a trustee, and I sort of came to find a absolutely drop dead gorgeous paramedic next to me, and I was like, oh my god, and I had no idea. That was probably the worst one, and there was another one that I didn't recognise, but somebody else at work did. And so I thought, oh, this is not good. And my HbA1c had started to go up, and I was doing the usual, the classic seesawing stuff. So I was correcting, and then so it was all getting a bit difficult. And then I went and had my annual diabetic retinopathy screening, and I had a tiny spot of background retinopathy in one eye. And I just thought, right, enough's enough. This is no good. I went to my GP. I said, I need to go back to consultant care. I need to go back and get tested out and checked out. So I've gone back, and actually, I'm now much better. It's a lot better. I've got much better control. I've got new meter. I got a new meter reading. I've changed my insulin regime. We recalibrated stuff. Got some expert advice, and actually I'm much better. Recognising hypos really early now. Not had anything like it as much. My highs are nowhere near as high as they were. I don't have to correct anything like as often unless I make a mistake in terms of carb counting or looking at what I'm eating, or it's much, much better. So the lesson for me in this was, don't get complacent, personally. Don't get complacent, and actually be prepared to say you need help. And there was something for me about, I'm the bloody chief nurse for England. I surely should be able to manage this. Answer, not always. You need help. Yes, you need to manage your own body, but actually ask for help if you need it. I do kids camp. I volunteer as a nurse. I quite often look after children or the youngsters with diabetes at Over the Wall, where we take children with diabetes. They often ask me if I'll do that because I do know quite a bit about it. So that's good. The reason the universities are up there is I'm a professor at St George's University and Kingston University. I've got two I have to say honorary PhDs for any of you think I've got two doctors. I'm a doctor of the university at Bucks. I'm a doctor of science from Edge Hill. Things like that, and then they're honorary. So, but people say, well, you don't use them, and I don't use the doctor titles because I haven't done a PhD, and I'm not a medical doctor. But the fact that people have recognised the work I've done and put me through the processes to give me those, I think has really helped and has really been good. So don't give up is my message, and do what matters to you. So Charlotte, I'll just put this up very quickly. Charlotte Austin, who some of you from Diabetes UK will know, took charge of the at my NHS, it was the at NHS web account or Twitter account. She's got type 1. She did the very, very first week. It was brilliant. She tweeted all week about her experiences of living with type 1. Really important, and we did a big media launch on the day of it started, and Partha gave me a bit of which is I think how he found out I had type 1 as well. And we did a bit of we did media coverage, and we did lots of tweeting around it. And actually, I don't use social media much to talk about diabetes, and I probably should do more of it. I've got 31,000 followers on Twitter. I could actually have quite a wide reach if I did more of it. And so I listening to some of the things that people have talked about, maybe I ought to do a bit more of it, and I ought to be a bit more out there and a bit more open. Today, there's been quite a bit of Twitter about the fact I'm here, and I've retweeted some of that. So that will have got to 31,000 people. But I do think using social media and getting networks is really important. So I've got 2 slides, and I'm going to stop. One I love Nelson Mandela's quotes. So the point about do not judge me by my successes, judge me by how many times I fell down and got back up again, I think is really, really important for those of us that live with diabetes. We will have ups and downs, we will have difficult times, we will have problems, but actually getting back up and being strong and carrying on is really important. The message about resilience is really critical, and a couple of you, and Mel mentioned it as well. Being resilient is really important if you live with diabetes. So I think that for me is really important, and having the motivation to want to do it better. And there's another quote which I nearly used but didn't, and that's Maya Angelou, who's was a wonderful woman, who said, you may encounter many defeats, but you must not be defeated. And again, that's something I think is really important. And then the last one is this, which is about taking care of yourself. The importance of looking after yourself and the importance of self-care is really important. And this says, for those of you at the back that may not be able to read it, taking good care of you means the people in your life will receive the best of you, not what's left of you. And I just thought that was quite important, really. So this is about looking after yourself, but also having fun. being normal, not letting it define you, learning from others. And the point that Adrian made earlier, which is diabetes is something and nothing, really interesting. I'm going to take the message about, can I get out of any meetings? To be honest, I've never done that. And what a fantastic opportunity to do it. So yeah, anyway, so I just wanted to finish by saying thank you very much for thank you to Partha for inviting me and for doing the TAD day. It's brilliant, and I looked at a lot of the I looked at some of last year's conversations. I hope I have no idea how long I've talked for, but
2.5 hours.
Okay. There's nothing worse, is there, than the last person in the day, starting late and then not shutting up. So I finished now, but thank you very much.
Jay, thank you.